Hello, my name is Daniel Chase. Suicide is defined as the intentional act of taking one's own life. Physician-assisted suicide is the taking of one's own life with the assistance of a physician through a lethal dose of medication. Today I will be talking about physician-assisted suicide and why I believe a person has the right to make their own choice regarding their own life. Now, before we get into why someone would resort to physician-assisted suicide, let's talk about the legal aspects of it. Today, in America, there are 3 states which allow physician-assisted suicide. In 1997, Oregon became the first state to legalize it. More recently, in 2008, Montana and Washington also legalized physician-assisted suicide. Now, with all 3 states, there are certain laws and stipulations that must be strictly followed before making this procedure legal. In all 3 states, a patient must be a legal resident of that state. Also, the patient must be diagnosed with a terminal illness with less than 6 months left to live. Also, in Oregon and Washington, a patient must submit 1 written and 2 verbal requests for the assisted suicide. In Oregon, a case is reviewed by a second doctor, and he must concur on the original doctor's diagnosis. Also, in Oregon, the patient is administered the medication and they're required to take the medication on their own. In Montana, the case is taken to a court and ruled upon by a judge. Now that we know a little bit more about the legal aspects of it, let's talk about why someone would resort to a physician-assisted suicide. Terminal illness. What is it? A terminal illness is a diagnosis given to a patient by a doctor in which the outcome is death. As I mentioned before, in all 3 states, the terminal illness must be diagnosed with a less than 6 months left to live. Now, why someone would resort to physician-assisted suicide with a terminal illness? Pain and suffering. Most illnesses or diseases come with pain and suffering. Most patients that choose the procedure want to relieve themselves of this pain and suffering. What must be considered prior to a patient considering physician-assisted suicide? How about their family? A family's decision is almost just as important as the patient's decision. There are certain burdens that a patient must think of before they choose this. Financially, can their family support themselves financially after the patient has gone through with the procedure? Is the family willing and able to pay for the cost of a funeral, the cost of burial, and all costs that come with a death? Let's look at some opposing views on why physician-assisted suicide may be the wrong choice. Are doctors right all the time? Can a doctor live with his or her decision? A doctor is not right all the time. Who else do we have to turn to? Another doctor? They go to school for over 12 years to be in the profession they're in. Can a doctor live with his or her decision? A doctor that resides in one of the 3 states that I previously mentioned knows that their potential diagnosis could result in a physician-assisted suicide. The abuse of assisted suicide. Can a doctor abuse his power? Can a doctor be financially persuaded by a family to make this decision? Anyone at any time in a position of authority or power may abuse it. We have to be sure that you choose the right doctor, that you choose the right company to go with. A doctor may be financially persuaded to choose this option, but it's not also a family's decision, it's a patient's decision. Overall, I agree with the patient that is diagnosed with terminal disease to go with the route of a physician-assisted suicide. Who are we to tell someone that they must suffer the pain of their terminal disease? In the end, if someone wants to commit suicide, they will. There's nothing we can do to stop them if somebody wants to die. We might as well give them the dignity and satisfaction of doing it their own way and with everyone's consent and making it legal.